Hello, good evening all. Am I audible?
Yes.
Yes,
Good
sir.
evening, sir.
Good evening, sir.
Good evening.
Good evening. Good evening, sir.
Good evening.
Good evening, sir.
So, guys, from today, we are going to start our training. It will be for next 20 days. Okay. And I
Yes,
used to take it on Saturday, Sunday also. If any day I am not available, that day only will take the session next day. Otherwise, there is no holiday on Saturday, Sunday. Okay. And every day we are taking for only 1 hour. Okay. And I'll provide you all the notes, all the material. You don't have to search on Google or YouTube anything. Whatever knowledge I'm going to transfer you, that is more than enough to crack the interview. And once you join in any company, you are able to work. I'm not saying that uh, from very first day they are going to ask you to start the work, but definitely they will expect you to work. They are not providing you the training again. They will just provide you the software training how to use the software. They are considering you as an experienced candidate. So from first day itself, you have to be very serious. If you are thinking that after training you will start for study, then it will not work, guys. And by doing the training again and again, also you will not get a job. The thing is that you have to study, learn, and you have to remember the things. If you have any question, confusion, anytime you can ask, clear the doubts. And this is not for 2 month, 3 month training. If you join as a fresher in any company, in your healthcare company, you will get 3 month training. Whatever we are going to cover in next 20 days, they will provide you the same training for next 3 months. Okay, and anyhow, they are not providing you more than 10 or 12,000 salary. Here we are going to save your 1 year. Okay, so you have to be more serious and aggressively study. And if possible for you guys, our session is every day. Our session is at 9 o'clock. So anybody can create the Google Meet link, and you guys can discuss on the topic. As for example, Shubham is asking the question to Ashutosh. Okay, so Ashutosh should consider that in interview you will face the same question. If you are not able to answer here, how you will face that question in your interview, right? So you don't waste your time. Okay, from tomorrow itself, start to discuss. That is called as mock practice, interview practice. It will help you to crack the interview within a 1 or 2 week only. So many openings are there, scope is very high, and who are expecting that you should get a work from home only. So for that you should be very strong, because the companies who are hiring for work from home, or if they are providing you a work from home, they are expecting that you should be able to handle the system and the claims individually without any help. Initial days, that is fine, you are new to the company, definitely there will be someone to help you, but they are expecting you to work independently. And if you are going to work from office, the environment will be there, some other guys are there sitting near to you, you can see their work, somebody will be there for floor assistance, they will help you in your work. Okay, so easily you can survive in the office. Okay, so work from office, always prefer to go to the office. If you are able to go to the office, then it is good. If you are thinking to do only and only work from home, very few options are there nowadays in the market. Okay, and most of the companies are asking to come to office for work. They will provide you cab facility, they will provide you dinner. Okay, because our shift timing is evening 5:30 to 2:30. Okay, if your any female candidate is there, then they will drop you first, and then only others they will drop. Okay, and security guard will be there in the cab. Okay, so don't worry, don't think that if you're a female candidate nobody will be there in the office. Like you, so many girls are working in this shift, and because we are working for US client, US process, so obviously we have to work in their time zone. Okay, whenever our evening or the night is starting, their day is starting. Okay, this is only the hard thing for us. And don't worry, in future, once you have the real experience, many companies are hiring for AR analyst. That work is in day shift. You can go for quality analyst. That work is also in day shift. Okay, so but at this point, for which profile we are taking the training, that is for the uh, shift timing evening shift. Okay, so daily 1 hour we'll do the training. I'll provide you daily notes. You have to go through that, and the same notes you can discuss with others on next day. Our training timing is 9 to 10, so you can join at 8:15 or 8:30, and you can discuss whatever we have done previously. Okay, so day by day we'll go from very basic thing we'll start, and day by day we'll go in very deep. How we are able to do our training within only 20 days? Because your batch is not the first batch. Almost 25 plus batches I have taken till now from last 2.5 years. Every month we used to take only one batch. Okay, no matters. Only 3, 4 candidates are there. Then also I am going to teach the same thing. If there are more than 10 candidates also, then also we will provide you the same training. Okay, and more than 80 plus candidates we have placed till now, and they are working currently. Okay, so we'll call some candidates. They can share their experience. You can ask your questions if you have anything in your mind. Okay, because we know that how we are going to the company now. But don't worry about those things. Whatever I am going to teach you, that is more than enough. Who is having 3 year real experience? You are also having the same knowledge. So be confident. Okay, and your communication should be very good. Okay, at least neutral communication should be there. You don't have to try the accent, but you should focus on your grammar. Where to use is, was, shall, should, could, would. At least these things you should know. Okay, then easily you can survive. Okay, and initial days be ready for struggle. Some at least 15 days, 20 days you will struggle for calling, you will struggle for writing the notes, you will get so many errors from the quality team, but that is fine, that is the part of learning. But we are not, the best thing is we are not going to sell any product here. Okay, if you are working for pure voice process, even though it is the international process, but if you are working for any selling process, it is very hard thing to convince someone to take or buy anything from our company. But here the best thing is that you don't have to sell anything. We are working for US hospitals. We are presenting as a billing department for them. Okay, and we are a mediator between the insurance companies, patient's insurance company, and the hospital. We are working for hospital. They are our client. Okay, so 95% people in US they are having healthcare insurance because healthcare services are very expensive. If they don't have the healthcare insurance, the services are this much expensive that they are able to come they are able to come to India, that they will take the service and they will go back. Okay, then also it is affordable for them. Just for changing the to do the root canal for our teeth, they are charging 2,000 to $3,000. $2,000 means it is almost 1,50,000. Okay, so now you can think that how much costly is their health related services in US. So this is the reason 95% people in US they are having healthcare insurance. That means in our hospital, if 100 patients are coming, from that 95 patients are providing their insurance ID card, and the picture is different in US, not like the India. If you are talking about the India, if you are having healthcare insurance, if you are going to any hospital, if that hospital is tie up with your insurance company, that is fine. There will be a cashless policy. and easily you can take the service and you can provide your insurance ID card and you can leave. But in case if the hospital where you are taking the service, that hospital is not tie up, not contracted with your insurance company, so in that situation we have to pay from our pocket. You have to take those bills personally. Either you have to go to the that insurance company office or agent, or online you have to upload. Then you have to wait for 1 month. Then only you will get your reimbursement according to your policy. But in US, it is 100% doctor's responsibility whether the hospital is contracted or tie up with the insurance company or not. Okay, patient will take the service if they are having any kind of insurance. Thousands of insurance companies are there in the US. So patient can take any kind of insurance from any company. It is their choice. But the challenge for the hospital that they have to deal with the patient insurance. Okay, to get the payment. Whenever patients are coming to our hospital, they are just paying 30 to $50 or $70 as a registration fees, and it is also according to their insurance plan. On their ID card, they will mention that this is the registration fee, or the it is called as copay. So we'll see that. That means for 95 patient every day we have to deal with their insurance. We have to send the claim for our payment, and we are only the team who are contacting, who are dealing with the insurance company, and we are not a single team in the company. Anywhere if you join US healthcare company or the medical billing company, it is also called as RCM, revenue cycle management. Okay, so 10 to 12 teams are there on the floor. Whenever you will join in any company and work from office, if you are doing the work from office, you can see that 10 to 12 different teams are there, and everybody is having different tasks. Okay, so don't think that you are only the person between the hospital and the insurance. Okay, we are all these teams are together called as billing company. Okay, so every task there is a separate team, and you will face this question in your interview. Explain the RCM cycle. But if you are facing this question that day, you are having hardly 2 or 3 questions in your interview. There will be only one round. They will ask you now the first round, that is not the round actually. Everybody is saying that my first round is clear, that is the HR round. HR is not the round. They are just taking your basic information, where you are working currently, how much is your current salary, how have you resigned or not, how much is your notice period, expected salary. These are the basic information they will take you from you, and when you are available for the interview, they will schedule your interview. There will be only one round, that is the operational round or the manager round. They will ask you some questions. We have the list of questions. I can share it with you, the notes and the question right now. You can mug up and you can crack the interview. But the thing is that you are not able to work in the company if you are, even though you crack the interview. For these 20 days we are not only trying to means we are not here only to crack the interview, but after joining you should be able to work in the company. Okay, many times we are seeing info park, IT park, so many companies are there, but we don't know what exactly they are working inside. Okay, so the actual work I am going to teach you, and the domain knowledge is very important. This is the healthcare domain. Okay, and they are considering you as an experience. That means they are not providing you the domain knowledge. Hardly they will provide you only the software knowledge, on which software you are going to work. Okay, there are thousands of software companies who are creating the billing software nowadays. Okay, like in our mobile also, we are having 2 to 3 bank application. If you are having different account in different banks, so we are using 2 3 applications in our mobile, but the basic functionality is same. You can transfer the money, you can download the statement. Okay, then you can see the balance, you can apply for the loan. So these are the very basic things that you can do this in every application. Only the look and feel will be different, and some additional functionality will be there bank to bank. but the core functionalities are there in every application. So here also thousands of billing softwares are there in the market. Some softwares are on the rental basis, okay, and some softwares the hospital they have created for their self, okay. So the basic core functionality will be same everywhere. Whatever the blocks you are seeing here, they are separate department, okay. For them, in the single software, all the functionalities are there. So all these departments are using only, means they are working on a single software that is called as practice management software, okay. So at this point we don't know for which specialty you are going to work, for which company you are going to work, for which state you are going to work. So you should know some state names also in US, okay. Like till now we are familiar with only India state, but you should know some state in US like Texas, Ohio, okay, California, Illinois. Okay, so the client will ask you in which state you are working currently. So you should be able to tell them at least single name. Okay, so see, Texas is the biggest state. Texas, Oklahoma, Illinois, Ohio, Pennsylvania, Utah, California. Okay, so one or two state you can remember, or you can tell them that you are working for Texas state because Texas is biggest state. Okay, and any state you can tell, but you should remember one state name for which client and where you are locating, for which state you are working. These kind of questions will be there. So don't worry, I'll share you the questions at last. Okay. So today we will see only the introduction part, how we are able to do our training in 20 days because everything is scheduled. Okay, I am not going to repeat anything. We are recording our sessions. I'll upload on our YouTube channel. You can go to the YouTube, search for the Career Fountain, and these videos are not the public video. So whenever I'll add your email address, then only you will have the access for this. So on daily basis, we'll upload your video. So till now, I have not created any playlist for today's miss for your batch. So we'll create new batch for you, and every day's video I'll upload in that. So in case if you miss any session, you are able to see that. And guys, by seeing the same video again and again, nothing will happen. The simple example, you have seen your favorite movies multiple times. Okay, many times we are seeing our favorite movies, but we are not, till now we are not the actor or actress. Why? Because we have not implemented those things. We have not tried to do the acting. So here also, by seeing these videos or the sessions again and again, it will not work until and unless you should understand the concept and you should try to answer if someone is asking you. So this is the reason I'm asking you to join at 8:30 and ask or try to cover the previous topic. Okay, whatever things you are seeing in this folder, we are going to learn each and everything in coming 20 days. Okay, and according to this sequence only we'll go. First of all, we'll create your base, and the main thing is for the denial management, we are going to apply for this department, denial management. We are standing here. Okay, so before us, these many departments are there, and we are working for only denial management. Okay, so as a AR, our designation is AR, account receivable, or sometimes we can say that AR caller. If you go to naukari.com or anywhere, you can see that how many openings are there every day. These companies are having opening. I'll search for the Hyderabad example. Some companies are providing permanent work from home. Okay, so I'll search freshness in last 7 days. Sutherland, V Technologies, Advantum, Ascent, VR Talent Hunt. Some consultancies are also there. Okay, so they are hiring for big companies, MNCs, and all these are the MNC company, multinational companies. Okay, because these companies are dealing with international clients, so obviously these are the multinational companies. Okay, you will get all the facilities, guys. Okay, you can go to the Cognizant, Wipro. Okay, TCS is there, Infosys is there. So most of the big companies are there in this market. So you can see that one day back, one of the R1 RCM company is there. So they are hiring 1 to 6 year. Their package is 2.25 to 5.50. Okay, it's depend on your current salary. How much is your current salary? On that only, they will give you the hike. Okay, so we should be able to grab these opportunities, but for that you have to read from very first day or the second day. Okay, today is only the introduction part, that is fine, but from tomorrow, whenever we'll start the actual training, I'll provide you the notes and you have to go through the notes. If you have any single line question, then also ask. Don't think that other will what they will ask. Okay, you need the job, you have to clear your doubt. Okay, so 1 second. I'll create. See guys, in US their date format is different. Okay, till now we are following the Indian format, that is the DD But in US their format is DD and then YY. Okay, and the naming format is also different. Till now we are using in India as first name, middle name, and the last name. But their format is different. Their format is last name, comma first name, comma middle initial. Okay, so we'll see that. So see, so many insurances are there in the market, and the single insurance company they can sell these many insurances. Some more insurances are there. Depend on the what kind of services they are giving under that plan. So healthcare insurance obviously it is providing the coverage for health related service. General insurances are there. Many people are taking the general insurances to save the tax. Okay, or after fixed time they will get some bulk amount. These kind of insurances are there. Dental insurances are there. Dental insurance will cover only dental related service. It will not cover any other services. Security insurances are there. So security means if you are keeping any expensive things in the locker or the bank, they will take your security insurance so that if something happen, then the insurance will cover that. Fire insurance is there, auto insurance is there. We are very much familiar with the auto insurance. Okay, like we are buying the bike or the car, it is very mandatory that you have to take the auto insurance. Traveling insurance, if you are traveling through train or the plane, in your ticket only the traveling insurance charges are there. Okay, so we are going to focus only on healthcare insurance. If your client is dental, then the policy will be dental related plan, and the single insurance company can sell these many plans. Okay, so whatever insurance card patient is provided, we have to make sure that his policy is the healthcare plan. Okay, if it is the auto insurance plan, then it will cover only accident related service, auto accident services. It will not cover any general services. If patient plan is the dental plan, it will cover only dental related service, the normal services will not cover. Okay, so we'll see that. But just remember that these many insurances are there or the plans are there in the market, and we are going to focus on the healthcare insurance. As per our general knowledge, some specialities are there. For every doctor, there is some speciality. Generally, uh, for anything is happening, then we are going to our family doctor who is providing very basic services. Okay, he is a degree level doctor and he is providing the basic services. If your condition is critical, then he will suggest you to go to the hospital or the specialist. Okay, so the same thing is in US also. Generally, people are taking service, normal services from their family doctor. They are also called as a primary care physician. Okay, so they will take the service from their family doctor. If the family doctor is saying that you have to visit to the specialist or the hospital, then only they will go. If the condition is critical, they will directly go to the specialist or the hospital like us. Okay, so these are the some speciality. The family doctor or the general physician, their specialty is the internal medicine. Neurologist is there who is providing the brain related service. Pediatric is for the children below 10 years. Gynecologist is for the digestive system and other services for the, and the orthopedic is for the bones, bone related service. Cardiologist is for the our heart related services. General physician are also called as internal medicine. They are providing the basic services. They are the degree holder. These are the MD, master degree. Dentist, anesthesiologist. If any major surgery is there, anesthesia is required. So special anesthesiologist is also one of the speciality for the doctor. He is available present in the surgery because he knows that the exact quantity how much anesthesia is required for the patient according to the service. Okay, so we are going to present as a billing department for maybe for the individual doctor or the clinic, or maybe our client is the multi-speciality hospital where more than 40-50 doctors are there. Okay, so we are presenting as a billing department for them. And like in India, if your family member or the friend or anyone, we know that if someone is admitted into the hospital for 1 week, 2 week, at last, at the time of discharging, we are getting a single bill. All the charges are there like pathology, radiology charges, hospital charges, room charges, doctor charges. Okay, if other specialist is coming from other hospital for visiting, medicine charges are, so everything is there into the single bill. Okay, but in US they have segregated these things. Okay, hospital charges are on different bill and the doctor charges are on different bill. Like in India, we know that every insurance company they are having their own claim form. Whenever we want to claim something to the insurance, for example, I am having Bajaj or the LIC policy, so I have to use their claim form. But in US, the US government is working on this sector from last 35 years. So this is the reason it is possible that more than 95% people in US they are having healthcare insurance. Okay, everything is not the private insurances. Government is also providing some insurance to the US citizen, but everybody is not eligible for that. According to the eligibility criteria, they will get the government insurances, and the major part of their budget they are spending on the healthcare. The people are also very much aware in the US. Okay, and don't think that everybody is rich who is staying in the US. The picture is very different if you go to the YouTube and see that how they are staying or surviving. The below poverty level people are there. Almost 12 to 15% of total populations of US they are below poverty level. They are staying, they don't have home, they are staying in their car itself. Okay, so how they can uh, afford this highly expensive health related service? So they are getting insurance from the government. Okay, so there are some eligibility criteria. We'll see that in detail what kind of insurances are there and all. So at this point, just remember that for hospital bill, there is a single claim form in all over US. Okay, in any state, if you go to the any state, if we are billing for the hospital charges, we have to use UB04. Okay, it is having 84 boxes, and we don't have to bother about these things because we are going to focus and learn about only physician billing, that is the doctor's charges. And for this, there is a claim form of CMS 1500. It is having 33 boxes. So we are going to take a separate session for CMS 1500. Insurance interviewer can ask you randomly some boxes from the CMS 1500. Okay, how it look like the claim form? We don't have to bother about the UB04. Don't worry, you can tell them that I'm not working for hospital billing, I'm working for physician billing. So at least you should know only the name UB04. You don't have to learn about what is meant by U and what is meant by B. Okay, don't worry. But the CMS 1500, yes, you should know each everything. What is meant by CMS, Center for Medicare and Medicaid Services. Okay, this much details you should know because interviewer is considering you as an experience. That means you are opening this claim form 25 to 30 times in a day. Every day from last 1 year, you are opening this claim form 25 to 30 times in a day. That means if he is asking you randomly some boxes from this claim form, he is expecting you to answer in millisecond. Okay, so you don't have to remember all the 33 boxes, don't worry, but I'll tell you the 12 to 15 boxes are important that you have to remember. So each and every box we will try to understand in the separate session, and always this will be in this color only, and every single claim form is a unique claim form because there is a barcode. That means whatever practice management software we are going to use, our hospital have to pay to the government for a single claim form. For every claim form they have to pay to the government. Okay, so here we are going to focus on our physician billing. If someone asks you, are you working for physician billing or the hospital billing? Your answer is, I am working for physician billing. That means the doctor's charges. And all over US, for physician billing, for any kind of insurance, we are going to use the same claim form, that is the CMS 1500, Center for Medicare and Medicaid Services. And it is my suggestion to everyone, if you can create a notepad or the notebook to note down the important points. Anyhow I am going to share you everything, but nothing will work, it will be in your mobile only. So instead of that, if you are having much time, whatever notes I am going to share, write it down. It is good practice to remember for long time if you are writing something. Okay, so how we are going to send this claim form to the insurance company? Thousands of insurance company, we don't know which patient is coming with what kind of policy and the insurance. So obviously we have to send this claim form to the patient's respective insurance company. Okay, so there are four ways to submit our claim form. This is the claim form, and there are four ways to submit this claim form to the patient's insurance. First one is the electronic way. How we are sending the email? Email means what? Electronic mail, right? So we should have the correct email address. Then only we are able to send the electronic mail, right? Email we can send if you have the correct email address. So here also, if we want to submit our claim form through electronically, we should have the electronic payer ID. I'll show you the how it look like. If you go to the ID card, this is the sample ID card for United Healthcare in the US. You can see that this is the payer ID 87726. Okay, and on this ID card you can see that they have provided the electronic payer ID. So this exact payer ID we have to use while billing electronically. Then our claim will reach to this insurance. And insurance company is also having different department. So might be possible that United Healthcare is having different plans and they are having different electronic payer ID. So we have to make sure that we should use the correct electronic payer ID. Then only our claim form will reach to the correct insurance and the department. Okay. Otherwise, if you are sending to the wrong electronic payer ID and if you are calling to the insurance and asking them about the claim status, they will say that claim not on file. They have not received the claim. Okay, because we use a wrong electronic payer ID. And this is the most preferred way to submit the claim form because this is the fastest way, this is the safest way, and this is the cheapest way. The costing is very less, only $4 to $5 are charges for a single electronic claim form. This is the fastest way. On the same day, insurance company will receive our claim form, and this is the secure way. We don't have to bother that it will go somewhere else. Okay, so this is the fastest way, safest way, and the cheapest way. Costing is less. Okay, so everyone is preferring to submit the claim form through electronically. Some insurance company they don't have this option, so that time we have to submit our claim form through paper. So physical claim form will be there, same like this one only. Okay, and the hard copy of the claim form, everything will print on this claim form. Okay, we cannot write or we cannot tick anything, but we cannot use any pen here. Okay, so instead in the printer, instead of blank papers, the claim forms will be there, and whenever we are printing from the software, those information will print in the respective boxes. So this hard copy we are sending through courier company to the patient insurance, and the costing for every single claim form of means the physical claim form, it will cost $18 to $20. Again, courier charges are different. It is depend on the distance. So again, $40 to $80 are for the courier. So that is expensive thing. Yeah. Electronic claim form, it is taking only $4 to $5. That's all, right? So that is the reason everyone is preferring to submit the claim form through electronically. Third one is the fax. Very few companies are accepting the claim form through fax number. Okay, most of the companies are expecting us to bill through electronically or the paper. But if the time is very less and if they are accepting through fax, how we are sending an email, the same e-fax will be there. Now nowadays fax machines are not there. Okay, electronic fax are there. So whenever we are having the fax number, like how we are sending the email, we are entering the email address. Instead of that, the same inbox will be there, same kind of software are there. Instead of email address, we are entering the fax number. That's all. So easily in your training, or you can ask to your team leader, okay, how to use the e-fax. They will teach you. Okay, don't worry. This is very easy way. Only 5 minutes will take to understand how to send the fax. And the fourth way is the via web portal of the insurance. Okay, some insurance company are having this option so that we can upload the claim form on their web portal. Okay, like only 2 or 3% insurances are having this facility. Otherwise, everybody is having these facilities. Okay, and most preferred is the electronic way. To submit the electronic claim form, we should have the electronic payer ID. Okay, so these are the four ways. The claim form means what? We are sending the bill. Whatever services we have provided to the patient, the bill is in the form of claim form. Okay. And how we are receiving the payment from the various insurance company? These are the payment way. How our hospital is getting the payment from the patient's insurance. First one is the EFT, electronic fund transfer. This is the fastest and the preferred way, and also the safest way. You are sending money through your online banking, Google Pay, Phone Pay. So if you are using the correct QR code or the UPI ID or the bank details like account number and the IFSC, definitely the payment will go to the correct account. So here also we have to register as a hospital. We have to register. We have to do the enrollment with that particular insurance company for the electronic payment, and that is the long process. It will take 1 week to 2 weeks. But once we have done those process, every time we will receive the payment from that insurance company electronically only. That means whenever they pay, on the same day we'll credit that amount, will credit into our account, into our hospital account, right? Second one is the paper check. That means a physical paper check, they will send it on our hospital address through courier company. So might be possible that in case in our address, in our billing address, some small mistake is there, the check will not receive, right? So this is the reason, uh, and it will take some days also, 15 days, 20 days to reach that check. Again, it will take 2 to 3 days for credit into the bank. So that is the reason insurance also don't want to go or send through paper check. Okay, most of the insurance company, they are having the setup for electronic fund transfer. Third one is the virtual credit card. Very rare companies are there who are using virtual credit card process for payment. Virtual credit card payment means, example, if I want to give you that, like 10 year back, we are recharging our mobile through scratch card. We are scratching the card, we are having some number, we are entering that into our mobile, and then the balance will come so that we are able to call. So the same process here. The credit card, actual credit card will not come to our hospital. Only the credit card number will come if insurance want to pay us $5,000. Example. So only the $5,000 will be there under that virtual credit card number, and that is the one-time usable number. Okay, and that will go to a particular person only for which we have registered, and that person will use that number, and then the amount will credit into the bank. So very, like 0.5% insurance company, they are using virtual credit card, the small insurance company. Otherwise other companies are paying through EFT and the paper check. Now whenever they are processing the claim, I am not saying that paying the claim. Every time we cannot expect insurance company will pay for every claim. Okay, that is the reason our job is there in the market. Whenever insurance company is not paying, we are there to find out why insurance company has not paid. So whenever insurance company are processing the claim, may be possible that there is a payment, there is a partial payment, that means they have paid only for two services, one service has been denied, or maybe they denied whole claim. Okay, so every time whenever they are processing the claim, they will create a receipt. That receipt will come, one copy will go to the patient, one copy will come to the hospital. Okay, so that receipt is called as explanation of benefit. Okay, so this is the paper. Explanation of benefit will be the paper EOB, that means through courier company it will come. Also another name for that is the explanation of payment. So I will show you how it look like, so that you will get some idea. So this kind, one second, this kind of receipt will come, and all the details will be there, how insurance company has processed the claim, how much they have paid, how much is the patient responsibility, how they have paid, the check number, EFT number. Okay, all the details will be there. This is the receipt. It is called as explanation of benefit or explanation of payment. And whenever they are sending through courier company the hard copy, then only we are saying it as the explanation of benefit or the explanation of payment. If they are sending electronically, that is called as electronic remittance advice. The same, it will look like this one only. Okay, but it is called as electronic remittance advice. If they are sending through electronically, it will come to our software, so it is called as electronic remittance advice. Might be possible that under a single ERA or single EOB, multiple patients information is there. For example, if they have paid $5,000 for 20 patients together, so all the 20 patients pages are there. We can go one by one and we can see that for which patient how much they have paid or denied. Okay, so our actual training will start tomorrow. Till now, today we have just saw the introduction part, for which process we are going to work, what is our exactly work, that is we are the mediator between the hospital and the insurance. We are working for a hospital as a billing department. We are having these many department and we are standing here in the denial management as a AR. Okay, and every day we have to do 8 to 10 calls to the insurance company to take some information about those claims where we have not received the payment. Okay, and many things are there. By using that we can avoid the calls, but where there is a need, absolutely we have to do the call. Okay, so only 30% accounts are there to do the call. Remaining 70% accounts you can do by analysis, by checking on their web portal, by calling to their IVR system, that means the recording system. So you don't have to communicate with, every time you don't have to communicate with their representative. Okay, and starting of the day, if you are calling, then you can easily reach to the insurance company within a 2 3 minutes, 5 minutes. But after 10 o'clock, 11 o'clock, it will take 10 to 15 minutes to reach at representative. So that calling part we'll discuss in detail. So here, this is our syllabus we are going to cover. Today is only the uh, introduction part. I am going to take your attendance every day. Okay, and all the recordings will be there on our channel. Tomorrow we are going to see this RCM cycle in detail. Then only you will understand all the department what exactly they are working. If you are talking only two lines on every department, then also you will take more than 10 minutes to explain this RCM cycle. Okay, and there will be only 8 to 10 questions in your interview. I already know that from which section how many questions are there. Okay, I'll share you the interview questions also which are shared by our previous candidates. Recent, I can show you the recent offer letter. One second. It is not loading. But the last offer letter received 5.5, 5.25 actually. Okay, and we are. I'm not giving any advertise anywhere. Everybody is coming through reference only. Initially, we have taken this training for at 3 to 3.5 months. After that, because the material was not ready that time. So see, you can see here 5.25, and it is 12 May offer letter. Joining was 1st June 2022. So the recent offer for 5.25. Okay, so and this is the permanent work from home. These kind of opportunities are there. You should be ready, guys. One second.